What's up everyone, welcome back to Mad Medicine. I haven't posted a video in a very long time and I am so sorry for that. I've been trying to do a lot of stuff, but medical school has really been kicking my ass recently. The third year is a tough year. I did not expect that. So it definitely has been a very stressful time, but today in this video we're gonna be talking about the top 5 myths about medical school, the top 5 medical school myths, however you want to say it, whatever. Anyways, a lot of you guys, a lot of undergrads and pre-med students who I work with have been talking to me about what medical school really is like. So I was like, you know what? Why don't we do a top 5 medical school myths video? And that's why we're doing it. Also, stay tuned to the very end of the video because I'm going to be giving you guys a bonus myth about medical school that you guys might not have considered. So stay tuned till then. And we're also going to be talking about where the channel is going because I have some really exciting stuff that I'm pretty sure you guys will want to hear because it pertains to y'all. Okay, so before we talk about any of that, let's talk about the top 5 myths about medical school, yo. Alright, so let's get started by talking about number 5. Myth number 5 is that you will have no free time. You will have no free time in medical school. Ladies and gentlemen, that is a myth. I'm gonna give you guys a few anecdotes. I'm gonna give you guys a little bit of information about why that's a myth because you will have some free time. Granted, it will not be the same amount of free time you guys have in undergrad, but medical school is not all work, and work, okay? Yes, it is a lot of work. It definitely is stressful at times. It definitely is very time-consuming work also, but there are times where you will have some free time that you can spend with your family and friends. Case in point, every year during winter break I get a chunk of time off, okay? And during that chunk of time, during my winter break, my wife and I like to travel. I like to spend time with her and with my friends instead of studying. Yes, I could be studying, but in fact I have this time off. I want to enjoy it. I want to spend some time to decompress before medical school starts all over again. Okay, so that is definitely a myth, and I really want to say that essentially medical school also comes down to just good time management. If you have good time management skills, if you guys are able to manage your workload along with your play load, the amount of stuff you're gonna play and enjoy with, you'll be fine. Yes, you will miss out on some things no matter what. You might not be able to hang out with your family and friends for every occasion that you want to. You're gonna have to make those sacrifices and you know that. But it doesn't mean that you're never gonna see them and you're only gonna be working. That's not the case at all, guys. It's not the case, okay? So that myth is just that. It's a myth. You do have free time in medical school. You do have time to enjoy your friends and your family and your significant others as well. So that is myth number 5, and that is the first myth we're gonna go through. Let's go through the next myth. Myth number 4 is that the content in medical school, all the content in medical school is hard. And no, not all the content in medical school is hard. That's the part of the myth that's wrong, okay? All the content in medical school is not hard. There are stuff that you're gonna see that's just a review of simple biology and biochemistry that you learned in undergrad. That comes up again, surprise, surprise. Does organic chemistry come up? No, it's not gonna come up ever again. It's a waste of a subject. I don't know why we have to take it, but it's stupid. Not all the content in medical school is hard. In fact, a lot of the content is pretty straightforward. It's very intuitive, and if you just think about what's happening in a very direct manner, in a very linear, straightforward manner, you'll understand the pathways and physiology that's happening, along with the pathology, the negative things that happen in our body that shouldn't be happening. It's very straightforward. But there are things that are very confusing. There are things that are very convoluted. Biochemistry, for one example, for me, it's super duper hard because I don't like biochemistry. I'm not a fan of biochemistry. I hate those pathways. So for me, it's really difficult because I hate learning it. I have no interest in learning biochemistry. Jesus. Okay, not all the content is hard. Some of the content is definitely hard, but there's just so much content. That's the part about medical school that's hard. Someone once told me that medical school is like drinking out of a fire hydrant, okay? There's so much material being thrown at you, and you have to absorb all that material and learn all that material. that it's nearly impossible. And it is impossible because no one can learn everything in that short amount of time. It takes years to learn all that material. Those doctors you're working with, that you are gonna work with, spent years learning all the things they know. Okay, so you're not gonna pick it up right then and there. You're just being exposed to everything all at once, and you're just expected to know bits and pieces of everything all at once. That's why medical school is hard. Not because the content is hard, just because there's such a vast amount of things you need to know. Okay, so that is myth number 4. We are done with the 4th myth now. Myth number 3 is also something I heard a lot when I was an undergrad. A lot of times I heard it from upperclassmen, people who were a little bit higher up the chain than me in school, and that was that all the doctors that you work with in medical school are gonna pimp the shit out of you. And before we move forward, let me explain what pimping means. It's not the street term we're talking about. It's actually an semi-educational term. Essentially, in the old days, the doctors would quiz you, would test you on the spot and see, hey, what do you know? Do you know this pathway? Do you know what this drug does? Do you know the mechanism of this drug? Do you know the pathology, the physiology of cancer, etc., etc.? They would pimp you on the spot, and you were expected to regurgitate all the knowledge you have in your mind about that material. And if you got it wrong, they'd make you feel like crap. Okay, that's pretty much what pimping is. Pimping stands for put in my place. Okay. So when I was an undergrad, when I was in pre-med, I heard a lot of people saying that doctors like to pimp medical students hard. They like to test you on the spot, son. They'll ask you, tell me the pathway for this, X, Y, and Z. And if you don't know it, you're dumb, you're stupid. How are you going to become a physician? You're not capable. What's wrong with you? Why are you going to blah, blah, blah? Stuff like that. And I want to tell you guys that's completely not true. A lot of the doctors who I've worked with, majority of the doctors who I've worked with actually, are so nice, are so helpful. They take care of their students. They take care of you guys mentally and physically. They'll make sure you guys understand what's happening. They'll let you guys practice so you can learn from practical skills and practical experiences rather than just textbook knowledge. So that's very important. And overall, in general, they're just very good people. There are some physicians out there who will pimp you, who love pimping you, and I'm sorry if you get exposed to that. I'm sorry, it sucks, it'll happen. At one point in your career, you will run into that physician who everyone knows has a reputation for pimping their students, and that just sucks. It's just, it is what it is. It be like that sometimes. But overall, the physicians you interact with are not trying to pimp you to put you down. They're trying to remind you, guess what? You don't know what you don't know. You, as a medical student, could be thinking, yo, I got placenta previa on lockdown, son. I know this, I got it down. Come at me, test me, I got you, bro. And then the doc's gonna be like, okay, tell me what drugs you use to treat XYZ that's related to blah, blah, blah. And you're gonna be like, yo, did not expect that because I'm a medical student and I don't have the experience yet. Okay, that's why pimping is so important, because it lets you know you still have a long ways to go in order to become the physician you wanna be, that you need to be in order to take care of your patients, excuse me. So it's a good thing, it's a good tool if used properly, and most physicians, if not all, use it properly. Okay, so just be aware of that, be rest assured, that's a myth. Not all doctors out there are super mean to the medical students. In fact, majority of them are super nice, they take care of the students, and they provide very good learning experiences. So that is myth number 3, guys. We are practically done. We got 2 more to go. And myth number 2, we're just gonna dive right into it, is that all you have to do in medical school is pass. You may have heard the saying, C's get degrees, or C's make MDs, etc., stuff like that. It's true, all you do have to do is pass, but realistically, in order to treat someone, to know how to treat someone properly, you cannot just get a C. You need to know the material in depth. You need to have a good understanding, because to treat someone, you need to know what's going on and everything that's associated with a certain illness in order to do the due diligence that that person deserves. So, definitely not true. All you have to do is pass is not something that you should be thinking about. It's not something you should be considering, because it's a bad mentality, guys. Have I done this? Of course I have. There have been times where I'm taking an exam and I'm like, yo, I just hope I pass. I don't care if I get a 90%. I'm just trying to pass. I'm trying to move forward. it does happen, and it will happen to you because medical school is challenging in many ways, but definitely do not aim to just pass, aim to do better than passing, so that worst case, you drop a little and you'll still pass, okay? Very important, very, very important. Now the last myth, man, this is something even I'm guilty of perpetrating or perpetuating. I don't know. I'm guilty of spreading this myth too. And the last myth is that medical school is easy. It is not easy, guys. Medical school, oh my God, is not easy. I'm in my 3rd year of medical school and I'm getting whooped, okay? I'm getting destroyed out here. It sucks. Medical school is not at all easy. If you guys go to one of my previous vlogs, I think it's my first one maybe, I think I said in there, medical school is not that hard. Medical school is not that hard. Oh my God, all you gotta do is study, blah, 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 blah. Look at me, I'm foreign, I'm so smart. No, if I could go back, I would slap myself straight across the face and be like, yo, you are an idiot, son. What are you thinking? So medical school is not easy. That's the simple truth. Medical school is meant to challenge you. It is challenging in many ways. It's mentally challenging, it's physically challenging, and it's emotionally challenging. Mentally challenging because this is gonna challenge you. This content, like I said, it might not be hard, but there's so much content that in order for you to learn it and memorize it and master it, it's difficult. You have to practice, practice, practice. You have to study, 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 and you need to make sure that the things you are weak on, you improve on. That is hard. That is mentally challenging. That will really push you to a limit. So that's the first part. It's also physically challenging because you're gonna have to get up really early some days, and some nights you will not get any sleep. Like, take it from me, guys. Last month, I was sleeping a total of 3 to 5 hours a night. If I was lucky, it was 5. Mostly 3 to 4 hours a night. You can ask my wife this. I looked horrible. I still have bags under my eyes. Like, my God, you might not be able to see this because I got a light up there, but if you guys go to the beginning of this video, I got bags under my eyes, son. It's hard. It's physically taxing, and I've aged. Let me tell you how much I've aged in medical school. When I got started in medical school, my beard was all white. I have a was all black. Ooh, that's bad. No, my beard was all black when I started medical school. I have a white hair somewhere down there. It's a white hair in my beard. Oh my God, it has started, guys. Medical school has made it happen. So it's definitely not easy by any means. Medical school is meant to challenge you physically as well. And then emotionally, it's very taxing because you may not be able to see your friends, your loved ones. You may just be working, taking care of patients, and that's great and all. But when you're working late nights, you're working long nights, you have no time to do anything else, no time to take care of yourself, it does become emotionally taxing. So it's not easy whatsoever. If you guys watched that first vlog and thought I knew what I was talking about, I had no idea, guys. I had no clue. So just ignore that vlog completely from now on. So those are the top 5 myths about medical school. I hope you guys enjoyed them. I hope they were informative, first of all, and I hope that they were helpful for you guys to know. Now, I want to tell you guys a little bit about where this channel is going because it really impacts you guys, and there's some stuff that you guys might want to know. The other day, I was thinking about where I want to take the channel, what I want to do with it, and I created this channel because I wanted to help you guys. I wanted to give you guys the tools to succeed, to get into medical school or whatever profession you want to go into in medicine. I wanted to give you guys those tools. And the thing is, the other day I was thinking, you know what? I want to create some educational videos. So I started creating these videos for the USMLE Step 1, which is like an exam you take at the end of your 2nd year. It's like the MCAT, but for medical students. Really important, blah, blah, blah. Anyways, I started making these videos teaching teaching for the USMLE Step 1. So if you guys are medical students or if you guys are going into medical school, go ahead and watch those videos. We've been releasing them every single day for the past month and a half now, and we're gonna continue that as much as we can. That's gonna happen. But I also realized that not all you guys are medical students or even close to getting into medical school. Some of you guys, probably the majority of you guys, are pre-med students, and you know exactly where I'm going. Ladies and gentlemen, we have started working on a comprehensive set of videos for the MCAT. Yes, a complete comprehensive set of videos for the MCAT I'm gonna make those videos, some slide decks for you guys so you guys can watch them, you guys can study for the MCAT with them, and I'm gonna keep it to the point, straight, direct things you need to know. We're gonna cut out all the BS that you guys see in the books. We're gonna keep it simple. We're also gonna do questions for each video, almost each video, so it can help you guys think how you need to for the MCAT. That's my goal. So we're starting off with bio. We're gonna do biochemistry, then chemistry, organic chemistry, physics, and I'm gonna figure out how to teach cars in the meantime, because that is the toughest way to teach. That's the toughest subject to teach and the toughest subject to master for the MCAT. So from now on, we're going to be releasing regular videos, regular teaching videos every single day, whether it's a USMLE Step 1 video or an MCAT video. I have not decided yet. I'm still working on that, but you're going to see regular content from this channel every single day. And at the same time, every Wednesday, the goal is every Wednesday. Sometimes it might not happen, so don't hold me to it, don't get upset. But every Wednesday, I'm still going to be releasing these informative videos for you guys, this informative content, so it can help you guys as an undergrad, so you guys can get a little bit more tidbits, not just educational knowledge that I'm giving you, some practical life skills and just some practical knowledge for pre-meds out there. Okay, so that's what we're gonna do from now on. Every single week we're gonna have a brand new video. That's the goal. Don't hold me to it because I get busy. And then, you know, every day those educational videos. So thank you so much for all you guys who are new to the channel, who are supporting this channel. I really appreciate it. Your guys' support means a lot to me. It really means a lot to me. Thank you so much for watching this video. If this video helped you in any way, if you guys like this content, if you guys want to see more, go ahead, like, comment in the video, and subscribe to the channel. Please subscribe to the channel. It will really help us out. And with that being said, I'll see you guys here real soon. Take it easy, guys. Psych, you thought we were done? No, we still got the bonus myth about medical school to go. So let's talk about the bonus myth about medical school. And that is that the only thing that matters in medical school are your board examinations, the tests that you have to take to get certified to be a physician in medical school. Okay, and those are the USMLE Step 1 or the COMLEX. Essentially, they're exactly the same exam, just different for the MD or DO students out there. And what they test are your knowledge for the first 2 years of medical school. And a lot of residency programs use those exam scores as a way to determine whether or not you'll get into their program. Now, is that the only thing that matters in medical school? Is the only thing that matters a test score? No. And a lot of people will tell you, yes, it really does matter. And of course it matters to a certain extent, because a lot of programs use the Step 1 or COMLEX scores as a way to weed out certain applicants and to then decide who are we going to give interviews to. I think in addition to those scores, of course they matter, but what really matters at the end of the day are 3 things. Number 1 is your personality. Your personality makes a huge difference because of the fact that if you're a good person, if you're a person who you can work with, other people can work with, who you make other people's day better, both the patient and your colleagues, it makes a huge difference. Because I could be having a bad day, but if I see you and you make me feel better, that makes me so happy in general, but also makes me happy to work with you, and that makes a huge difference in the workplace, especially in medicine, a career that is very taxing to a lot of different people across the board. Number 2, your work ethic. Your work ethic is so important because you may not be the smartest person, and often you will not be the smartest person in the room. But if you are hardworking, if you are able to put in the work that needs to be put in to take care of the stuff that needs to be taken care of, I guarantee you people are going to want you over the next person who's just smart but lazy, because at the end of the day, things need to get done and you are going to be able to do them. And at the same time, the stuff that you don't know, the content you don't know, you're able to go out and learn it and improve your knowledge base because you are hardworking, and essentially that makes you such an asset for people, for programs, and for hospitals to have. Okay, that's so important. So that's the second thing, is your work ethic. And then finally is your outlook. If your outlook is very good, if you realize that yes, you may have a bad day, but the rest of your day is going to be good, it also makes a huge difference for you, because that means that you can isolate the negative things that happen at work away from all the rest of your day. So when you go home, when you see your friends and family members, you are still able to enjoy your time with them and have a good time. I think those 3 things are the most important thing, along with your grades, of course. Together, that is what determines whether or not you're going to be a good physician. And with that being said, thank you so much for watching this video. I hope you guys liked this content, and I hope you guys subscribe to our channel so you guys can see more. So don't forget to hit the subscribe button in the bottom, hit the bell notification if you guys want to, and I'll see you guys back here real soon. Take it easy, guys.